Experts are urging stakeholders in the medical sector to prioritize the provision of psychological first aid during catastrophes and emergencies. The call was made at an event organized by the Lagos State University Teaching Hospital to mark this year's World Mental Health Day, highlighting the importance of mental well-being in disaster response. Health correspondent Aminat Elegushi tells us more.
The need to provide mental health services to victims of catastrophes and emergencies took center stage at a gathering of medical experts here at the Lagos State University Teaching Hospital, LASUTH. Highlighting the risk associated with mental health during prolonged periods of stress and uncertainty, psychiatrist Professor Rotimi Koka stressed the importance of medical practitioners prioritizing mental health support.
All stakeholders in medicine and other sectors must provide and promote mental health and psychological services for our people in affected areas. When we invest in community-based interventions that we are propagating here, we address mental health needs, foster long-term recovery, and empower people and communities to build their lives and thrive well.
Other experts also spoke on the critical role of psychosocial support during emergencies.
Several studies showed that a lot of people came down with mental health disorders at that time, even people who had not had mental health disorder prior to the pandemic era. So it has shown worldwide that our mental health should also be taken care of during times of catastrophes and emergencies, during global crisis or traumas. So this year is to highlight the inclusion of mental health response in emergencies such as this.
Through the effort of our departments and all the staffs of our hospitals, and especially the Department of Behavioral Medicine, we will continue to strengthen systems that provide trauma-informed or compassionate and patient-centered mental health services.
Use of substance increases the risk of different mental health problems, and that to maintain a good mental health, one of the steps that you can take is to avoid the use of psychoactive substances. But we do also know that sometimes people use psychoactive substance not necessarily as an habit, but because they have an unidentified mental health problem.
With the theme, Access to Mental Health, Services in Catastrophes and Emergencies, the message was clear. Medical stakeholders must ensure prompt mental health care for victims in need. Aminat Elegushi, LTV News.